If you go to a convenient care clinic or walk-in clinic, the nurse practitioner, physician's assistant will, whether she can see or he can see infection, they're not really good at looking through that otoscope, I can promise you that. 100% of the time, if you walk into a convenient care clinic with the symptom of earache, you will walk out with a prescription for antibiotics. And I've explained how that anatomically can occur, how chronic inflammation within the temporomandibular joint can actually penetrate into the surfaces of the external auditory canal and feel like an earache. But it's not an infection. Antibiotics will handle infections. They don't handle chronic inflammation. But patients walk out with thousands, actually millions of prescriptions for antibiotics when the actual pain is coming from inflammation within the temporomandibular joint. Once you get past then the earaches, then you get into the other three non-painful symptoms that are well known, well established with temporomandibular joint patients, which are tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, and vertigo, dizziness. Those three symptoms have the diagnostic name of Meniere's disease. If you walk into a ENT practice with one or more of those symptoms, you will get a very extensive and very expensive workup, probably including an MRI, and you will be told that you have Meniere's disease, of which the ENT surgeons have no solution. We do not understand Meniere's disease. We have no solution for Meniere's disease. There are a few doctors who throw things at the wall to see whether they stick, but the average ENT doctor will admit they have no solution for Meniere's disease. On the other hand, it is anatomically shown and proven that chronic inflammation within the temporomandibular joint has access to the middle ear, allowing chronic inflammatory fluids to get into the middle ear, where your hearing mechanism and vestibular mechanism is, causing, when those tissues, when those areas within the middle ear get exposed to fluids of chronic inflammation, they will respond by creating the symptoms of tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, and dizziness, vertigo.